get started. Tonight, this event is sponsored by Holland Healthcare, and they have been gracious enough to let me invite my dear friend Holly, who, as I said, is somebody that I really consider to be one of the top experts and one of the top speech-language pathologists who helps children who have eosinophilic esophagitis. So I'm going to have Holly just tell everybody a little bit about herself, because I know her really well. Holly, can you tell everybody why this is so important to you, and just a little bit about your journey to becoming really one of the experts in our field around EoE?
Absolutely. Hi, everybody. Thanks for tuning in, and thank you, Mel, for inviting me. So EoE is very personal to me because I was a picky eater and a chronically ill child growing up, and no one could figure out the etiology. And once I started working at one of the top children's hospitals and listening into physicians, I figured out that I, in fact, had EoE undiagnosed as a child, and underwent the testing and found out that I had a pretty severe case, actually, and really wanted to focus my field on helping these children who also have EoE that didn't have access to feeding specialists, like I didn't have an access to a feeding specialist growing up. And so that's why I've really put all of my effort into researching and learning more about EoE, and learning from people like you and how to adapt philosophies for feeding therapy to best help these children.
And now you're helping kids through telehealth, especially with everything we have going on in 2020. But last year you had some information. Was it research, or tell me what was published in that journal?
Sure. So we did a study of 2 patients with EoE that lived in states that were not in Colorado where we were treating. They were the first 2 patients for feeding via telehealth. Both had EoE and they did not have access to feeding therapy locally. And so we really pushed to trial and pilot a telehealth program back in 2016, and saw them for the first time and collected data to see if we could help them. And then Gastroenterology Journal published our paper and our research showing that, in fact, they did make progress, even though they weren't physically in the clinic, and that it actually provided really quality care because we were in their home environment, able to manipulate, their kitchen table, what chair they were in, if the TV was on, if the dog was sneaking back
Right.
under the table. um, and so that was published in 2019.
Wow. And for everybody listening, Holly's really modest, but she's also an international speaker. She's a fabulous presenter. She and I are hoping to do a course together next year. We're working on that now. So I feel really, really privileged, not only to call you my friend, but to have you here tonight. And I also want to take just a moment before we get started and thank Holland Healthcare for being our sponsor. You were just talking about telehealth. And for everybody listening, I think many of you are familiar with the fact that Jennifer Holland, who started Holland Healthcare, an awesome mom who had an idea and went on Shark Tank and got the backing, created the throat scope. And today, Holland Healthcare is giving away a throat scope along with a pack of the recyclable blades. And Casey, out in Australia with Holland Healthcare, has just put the information about how you can win that. But what I wanted to take just 1 minute to show everybody is the latest and greatest that Holland Healthcare has come out with, if I can say that, and it is the Telscope. So since Holly was just talking about telehealth, I want to say what it is it's the throat scope, but it is attached to my iPhone, and I can actually take intraoral pictures and then send them to a gastroenterologist, to an ENT, etc. Now, Holly, can you tell everybody, maybe it's a silly question, but eosinophils are white blood cells, and they're typically seen by we view them via a high-powered microscope. Mm-hmm. So something as amazing as being able to take an intraoral picture on your phone, unfortunately, we're not going to be able to see anything microscopic. Can you tell everybody who's listening a little bit about what an eosinophil is and how it affects the esophagus and consequently creates eosinophilic esophagitis?
Yeah, absolutely. So an eosinophil is a white blood cell. You are absolutely right. And what happens in eosinophilic esophagitis, or EoE for short, is that there's a buildup in the esophageal tissue, and which causes lots of inflammation, which in then return makes swallowing really difficult. So kind of think about if you were on a water slide and you had one of those inflatable tubes around you, and those were your eosinophils, and you're trying to get down and it's stuck. That's kind of like what food feels like when you have all this buildup of eosinophils. And it's with EoE, it's primarily they're built up because it's a chronic allergic reaction, and so there's a food protein that is causing the inflammation or the buildup of white blood cells.
And so, when you're seeing young children, well, how young can children be diagnosed with EoE? I know we had a child, one of the first kids to be diagnosed here in Colorado, a little before age 2, but typically, what do you see?
So you can be diagnosed with it in infancy, and typically what you'll see is a lot of kids spitting foods out or really using a lot of liquids to help wash down their foods because the food feels like it's getting stuck, or that they're completely refusing crunchy or more advanced textured foods because they can't get them down or they feel uncomfortable. So they prefer a wet, soggy puree diet.
Uh-huh. And so a lot of the kids who are younger and may not have the language skills to describe what they're experiencing, or this is kind of what they've known all their life, so they don't
Right.
really know to describe something different. Is it more that we're watching for these behaviors that we just talked about, or do you ever have kids actually talk about that feeling of choking or not being able to swallow? In your experience, kind of tell me what you typically hear and see.
Sure, great question. And so, with some of the kids that don't have the language yet, you could see them really do effortful swallows to push
Mhm.
foods down, or you will see them doing the behaviors where they'll drink cup after cup of milk or water to get the food down. A lot of times, I've seen children literally take their food and dip it into their drink to make it soggy
Oh,
to
wow.
eat the food. It's more common than you think, or they'll smother everything in their dips and sauces.
Yeah.
But older kids, even as young as 2, if they have the verbal skills, they'll say that they feel like it's stuck or that they're choking, and that's how they'll verbalize it, that it feels here, even though in actuality it's more likely down here.
Oh, interesting. Okay, so that brings me to my next question. So, for example, I'll let everybody see here. That's actually my mouth. I took my own picture, and with this particular system, the telescope, obviously I can even get as far back as the tonsils, and I've even measured the distance from one tonsil to another. But you're saying that the eosinophils would be below the vocal folds, or how far down in the
Yeah.
esophagus?
Yes, they're below the vocal folds. And so they take biopsies distally and proximally, and so they are sadly too far for that beautiful scope. Um, I wish that
Wouldn't that be
was
great?
something. I know, I'm just saying.
I'll
Uh,
share. We need that one now. That'd be great.
um, but yes, they're further down.
And so those children would have to have some anesthesia and be scoped by a pediatric gastroenterologist, typically, I would assume. And they would go in, they would do biopsies. And my understanding, too, and please correct me if I'm wrong, because you're really the expert here, is that many kids have to go back in frequently for more biopsies, more almost to monitor and make sure that the treatment they're being provided is actually helping.
Yes, you're correct. They have to go in multiple times, often a year, or after every food introduction, depending on what the child's medical plan is, whether it's a food elimination diet approach or a medicinal approach or a combination approach.
I
There and recently, sorry, Mel, there are other scopes that you can do unsedated, where they go transnasal endoscopies through the nose while you're awake and take biopsies, or they can do it through a G tube now.
Oh, wow, I didn't know that. So I like to
Yeah.
talk to you. That's fantastic. So let's talk about 3 reasons why kids with EoE might be really anxious to try new foods. It sounds like they have to go through a lot of testing. A lot of people at their face, and it's not necessarily comfortable. So I'm sure that comes into play. But what other sort of associations do you see that really make these kids more hesitant eaters?
So you really kind of nailed it on the head. They have a lot of bad associations. And what's tricky is that they often will have a food in their diet prior to their EoE being under control. And let's say it made them sick or vomit or have abdominal pain. And we're asking them to try the food again. So they're naturally going to be more anxious about it because they already have that bad association.
Sure.
And it automatically affects their desire to want to try it again.
Yeah, yeah. I always say that one of the things that a feeding therapist does, besides build skill and ability, is we also pay attention to the memories and the files that children have in their brain. And they come to us because they have a lot of negative experiences filed away in their brain. And our job is to build positive files in their brain. And then the more positive experiences they can file away, they'll actually start to send those old files through the shredder and they'll be history. But you've got to replace them with positive experiences. And that's why it's such slow and steady progress, because there's just, we have to make sure there are plenty of opportunities for positive exposures. And now we've got a child who also has medical issues that can get in the way of those positive experiences that we've been trying to create. So when I think about medical issues, what sort of reaction would the kids have besides internally? Do you ever see anything externally?
Yes, you can. So oftentimes with this diagnosis, children they can develop hives, they can develop eczema. They also can have an IgE allergic reaction, which means they would need epinephrine or EpiPen. It just kind of depends on what type of food allergy or sensitivity they have. So, is it a true IgE mediated food allergy that requires an EpiPen and they need to avoid that due to them being allergic and it affects their EoE? Or is it a food sensitivity that makes them vomit and have excruciating, abdominal pain and maybe other lower GI symptoms, which aren't as common, but we do hear that children have those as well.
And I know in Raising a Healthy, Happy Eater, my friend Erin, who I think her son was one of the first children to be diagnosed here in Colorado with EoE. And she also explained to me that environmental allergies can also help, unfortunately, trigger some of those responses as well. So I would imagine that if you're a child who has experienced either an anaphylactic reaction or some sort of incredibly uncomfortable medical internal reaction, or just even vomiting, that those types of negative experiences, not only do they lead to a hesitancy to try new food, but you always got to be kind of worried about what if that happens, right? And so here's
Exactly.
my friend Holly. I'm a little kid, and here's my friend Holly trying to encourage me to try new food. And I'm so anxious because in my mind, I'm thinking, what if? What if?
Exactly. And so, what's great about this diagnosis is that we do have more information, and you can come to these therapy sessions with these children and have more information. You can show them lovely slides of their
Yeah,
esophagus and say, like, look at your esophagus used to look like this and it was really inflamed and now it looks so shiny and all of the white plaque cells are gone and it looks healthier and your medicine is working. It's time to try this food again because your esophagus is in a different place. It's when I love to, all of your great and fabulous books are a great opportunity to use in feeding therapy because they just give kids more information and knowledge and tools in their toolbox to know about their bodies and how to describe how they're feeling. And so I also like to use that now in therapy too, because if they eat something, I want them to have the language as a speech pathologist to be able to say, that makes my throat itchy, or that does feel stuck when I'm trying to eat it, or I think that's going to make me sick, those types of things.
yeah,
But you're right. They genuinely can be very scared to react to the food again. Or a lot of these kids that we'll see, we're starting their diet from scratch. They've been on elemental formula since birth. And they have no idea what it means that they're allergic to it. Is it the allergy that they could die and they need an EpiPen, or is it the allergy that they're going to vomit and be sick? It's confusing.
It is confusing, and if you've been on elemental formula since birth, you don't have a lot of joy around food.
No.
Do you specifically address that in your therapy sessions? Would that be one of the reasons, especially these kids have a hard time trying new foods because they just have not experienced a lot of joy around food?
Yes, absolutely. And I like to say that these kids eat to live, they don't live to eat. And, eating in general, like you had said, has been a noxious experience, and they don't get joy from them. It's not something they seek out or look forward to. And so, what I try to do is tap into some of the things that they do enjoy. Maybe that's being in the kitchen with mom or dad or grandma, helping prep some of the foods with their safe knives and mixing bowls and following a recipe and baking and trying to find other ways that they could enjoy being around the food that doesn't involve necessarily eating it to begin with.
Yeah.
And you would be surprised that this population loves cooking shows and recipes, even though often they might not be able to partake in the recipes. But I love using that as a tool in the kitchen.
That's so great. That's so great.